talk about a very interesting topic, a question that every new mother has in her mind when she is pregnant. That is things that she should do in her first trimester. Welcome, doctor.
Hi, hello Seema. Thank you so much for welcoming me to this platform.
The honor is mine, doctor. So you can brief our users about, why did you choose this topic and, some things that, you generally want to advise them before we actually get into the topic.
Yeah. Welcome everyone. It's a big congratulations to all the ladies who have got the magical 2 lines in their pregnancy test kit. So as soon as they're pregnant, there's so many questions, so many confusions, especially for the first time mom. So here we are trying our best to sort out your queries and make you in ease to go through the initial first trimester, initial 3 months. And like it's a first step whenever you're pregnant, you have so many queries, kya khana hai, kya nahi khana hai, what to do, what not to do. So let's have a discussion on that. I think Sima will finish the question answer section first. Then if time left, I can brief about other topics which are left out from Q&A sessions.
Okay, sounds great to me, doctor. So we'll start with बहुत ladies को first question जो आता है दिमाग में जो trimester में divide करते हैं pregnancy, तो कौन से week से मुझे first trimester या second trimester चालू और खत्म करना है? You can tell our users about that because that's the first question that comes in anybody's mind.
Yeah, very brilliant. Actually, there's a lot of confusion that whenever we calculate pregnancy in weeks, we calculate from their last menstrual period. That is the first day of their last period. And then followed that, maybe there'll be an ovulation time on day 14 or day 20, depending upon their cycle. So whenever a pregnant woman approaches a doctor, everything runs out in weeks. So entire 9 months pregnancy, 9 months plus 7 days is considered as 40 weeks, which starts from first day of their last menstrual period. So initial 3 months, that is initial 12 weeks of pregnancy, is considered as first trimester. Next 3 months, that is 12 to 26 weeks, is considered as second trimester, and then the third trimester. That is on rough a calculation. So do not calculate your weeks from the day of you had intercourse or from the ovulation day. It is always from the last menstrual period. So today we'll have exclusive discussion on initial 12 weeks or initial first trimester, and maybe in consecutive sessions we can discuss about other trimesters.
Okay. So as a woman, what are the changes that a woman can expect in her first trimester? क्या bodily changes होते हैं, something temperature related or certain internal changes?
Yes. So first and foremost will be missed period. That is the one click we get to know, oh, I've missed the period. And sometimes a ladies with even otherwise delayed cycles, they may not pick up that. They might think it is natural. वैसे भी मेरे cycle late होता है, so there may not be pregnancy. So first thing is missed period. Second, very common symptom is kind of nausea, uneasiness, not liking the food which used to like before, any kind of food smell making you pukish. So nausea and vomiting is the second most important common symptoms. Third symptoms, there can be some discomfort in the breast, a heaviness or kind of pain, dull lower aching pain. There can be tiredness, dizziness, loss of interest, and sometimes even a mild period like cramps can be there. Urinary symptoms can be there, frequencies can be there, and headache and little increase in acidity or the upper abdominal pain, heartburn. These are the common symptoms of pregnancy.
Okay. The next is a very common question, which is the dietary changes. क्या खाना चाहिए और क्या नहीं खाना चाहिए? Because there are a lot of controversy. Me being an author, I come across this common question कि papaya खाना चाहिए कि नहीं, which is a very common question. People have so many doubts.
Yeah.
It would be great if you can clear all these.
Yeah, so let's see first क्या नहीं absolutely नहीं खाना चाहिए. First and foremost, as you said, papaya. See, scientifically it is proven that raw papaya has some chemical which can act as an abortifacient. So you can avoid eating raw papaya, and generally raw papaya wouldn't be eaten directly. Max, some people use it in a curry, maybe in a rasa form or in the like a dry sabji form. So raw papaya you avoid. And ripe papaya is in fact very good for pregnancy. It has a lot of vitamin A and vitamin C that's good for pregnancy. So considering the fruit part, all the fruits are okay except raw papaya, provided you eat in a proportion, moderate proportion. It's not like every day you keep on eating a ripe papaya or every day you keep on eating a pineapple. So every day eat some two different fruit. Like banana and mango are also said to have like little bad effect on the pregnancy in a common man, but no, it is not like that. Both are very healthy, but eat in moderation. Eat seasonal fruit. Now, like this is a grape season, so eat grapes now. If you're eating grapes after, like when it is not a season for grapes, it might be a frozen food, or it can be like hybrid, so don't eat that. So seasonal and local fruits all can be eaten. All vegetables can be eaten. All kind of juices like coconut water, sugarcane juice, buttermilk, kokum sharbat, any kind of liquids can be drunk. And no alcohol, no smoking, tea and coffee in moderation. Coffee or tea maybe 1 cup a day, or if you want to have 2 times a day, then you can have it in a mild form. All right. And basically, for a non-vegetarian, that's a question: non-veg khana hai ki nahi? So egg can be eaten twice a week. Any kind of meat can be eaten, but you always eat very well cooked meat. Uncooked meat can cause some issues, some infestation, some infections. So cooked meat, and when you're eating salads, like maybe a cucumber salad or a carrot salad, so eat it with very nicely washed, and as much as possible eat a cooked meal. And another thing is regarding outside food. Like always, doctors say कि बाहर का मत खाना अभी you're pregnant. So what does it that mean? Like many of us are maybe dependent on बाहर का खाना when you're in a PG or whatever it is. So important is बाहर का खाना मत खाना, because if it is not hygienic or if it is not clean, because of that, if you get an infection, to treating that would get difficult in pregnancy. So if you have a home cooked food, we know that it is clean. So if at all there is a scenario where you have to eat outside food, eat from a good and clean place. Oily food we have to avoid, basically to avoid unnecessary weight gain and throat infestations, infections and all that. So don't try to avoid as much as possible deep fried food. Maida products may be in the form of chocolate, cakes, biscuits, breads, buns. They have zero nutritional value. They're not going to help you anyways other than giving a good taste. So if we could cut down on those products and increase more of fruits and salads and a good diet, or maybe mixed veg parathas and all that, and maybe good healthy snacks that can be replaced. And I think in Chinese, like Ajinomoto is said to be not good for pregnancy, so you can avoid Chinese meal. I think I've covered most of the points. If you feel anything, you can definitely let me know regarding the diet.
Okay, I guess no, you've covered everything. So next question is, since we know there will be a weight gain in pregnancy, a lot
Yeah.
of people switch to prenatal yoga workouts. So what are the workouts that a woman should avoid, and what are the workouts which will benefit her to
Yeah.
maintain her weight?
Yeah. So to make it very easy, what I would say, a lady, if she's already used to kind of good exercise, she's a regular person who does yoga, then you carry on with that. If you are a not kind of exercising person, hardly you're walking for 5-10 minutes a day, then don't start any new heavy exercises in the first trimester. Wait for you to complete first trimester, maybe 18 weeks, and then join prenatal yoga and start the heavy ones. But initial 3 months, if you do not have any kind of bleeding or any history of previous multiple miscarriages, walking is very good. In fact, it is beneficial to keep the stamina and strength. So moderate walk in a moderate speed, stretches, pranayamas, breathing exercises, and the kind of exercise which you are used to it. So you can continue. Treadmill, cardio, and heavy running, skipping, these are not advisable in first trimester.
Okay. So if not followed, the advice that a doctor gives, what are the common complications that a woman is at risk of in the first trimester? Like जो early symptoms की वजह से हो सकता है, early infection की वजह से हो सकता है. What are these common complications?
Yeah. So see, everybody gets happy when they see a pregnancy test, but having a first scan which says that baby is all well, heartbeat is there, baby is localized at a safe place, that is very important. So common mishaps, what happens in initial trimesters is definitely miscarriages. It can be in the form of that patient can start having bleeding, or there can be pain, or there can be no symptoms, but on sonography we get to know that baby is not growing, or the heartbeat which was there previously has stopped now. So these are the mishaps can happen. Second thing is hyperemesis gravidarum, that is a scientific term we use, wherein because of excessive vomiting, the pregnant mummy gets dehydrated and the complication followed by dehydration. So a request or a tip from my end is, it is always common to have nausea and vomiting in pregnancy, but you bear it as much as you can. Do not keep on puking entire day. There are very good antiemetics available, there are very good tablets available which are very safer. So you can consult your gynae, take those tablets and have good amount of food as well, so that you do not land up in dehydration or malnutrition on that phase. And infections are generally not so common in first trimester unless you have low immunity like a diabetic or if you're on any high medications.
Okay. So can you let us know the side effects? कोई कोई जन over the counter medications ले लेते हैं, कभी बैकएक हुआ, stomach cramps हुए, या कभी self prescribed medications ले लेते हैं. Can you just advise these women कि क्या side effects हो सकते हैं if they do not consult a doctor and self prescribe the medications during certain pains?
A very, very important question. See, initial 3 to 5 months is a crucial time where the baby's organs will be developing. If you understand, the baby will be one cell staged when it is formed, the embryo. Then it has to divide in adequate proportion. It has to form itself into a healthy baby or a healthy child. So the major part of it will be done in the initial 5 months, maybe development of heart, development of brain, hands and leg, maybe IQ thing, neurological development. Everything happens in the initial 3 to 5 months. So if we take any inadvertent medications which are not allowed to be taken in pregnancy in maybe low dose or in maybe high dose or in a moderate dose, when it is not allowed, it should not be taken in that pregnancy period, so that you would not end up with anomalous child or an abnormal child. So that is the main reason not to have self-medicated medicines. Second reason, there are some tablets which can act as an abortifacient. They can develop cramps and bleeding and can lead to miscarriage.
Okay. So the prenatal vitamin supplements जो देते हैं, how do they support the pregnancy and why are they so important to start right from the time we are trying to conceive and continue in the entire pregnancy?
Yeah. So the main hero in this is folic acid tablet. Ideally, it has to be taken even 2 months prior pregnancy so that you adequately replenish your folic acid level. You have a good store of folic acid so that whenever the baby is forming, the basic raw material to form the nerves is folic acid. That is the one which forms the sheath of the nerves or the forming nerves of the baby. So when there is depletion of folic acid, that part wouldn't be formed properly. So there will be something called as neural tube defect or some defects in the spines, and then that pregnancy cannot be continued. So folic acid is very, very important. Even by chance, if any of the couple are listening who are planning for pregnancy, please do consult doctor and start folic acid as soon as possible. And other multivitamins and proteins are not must unless your diet is deficient or if you're suffering with like any vomiting or something. But must is folic acid.
Okay. So in case of assisted pregnancy या IVF से जो pregnant होते हैं women, उनके लिए कोई special care है? They have to take some special care other than the ones who are getting naturally pregnant in the
Yeah.
first trimester?
Yes. So basic difference I think is about progesterone supplement. The pregnant women who have conceived through artificial reproductive techniques or IVF, they would need little bit of more pampering and little bit of more progesterone support. And I personally feel that even if you take little bit extra rest after taking so much of effort and conceiving, wouldn't harm. So initial 3 months, even IVF mommies, please take good rest and take your medications well. If doctor has prescribed you any injections, maybe blood thinner injections or the progesterone injections, please take them. Once you cross that third or fifth month, then it gets quite comfortable and easy. Then you can continue exercises in all routine like any other mommies.
Okay, that was great. Actually, I have covered most of the important questions. In
Yes, yes.
case if I have missed out few, you can add it, and then at the end we will take the user questions.
All right. So diet, exercise, yeah. So another thing is when to go to doctor. That is a big question. When I would say that you go to doctor whenever you see a positive pregnancy test or 2 lines on the pregnancy kit. Why? Because see, out of 100 pregnancies, we have seen 2 or 3 pregnancies land up in two. We call it as ectopic pregnancy or tubal pregnancy. Now that anyways that pregnancy is not healthy, but that can endanger mother's life also. So having a one scan which shows where is the pregnancy to confirm it is in the uterus is very, very important. Maybe initial times, maybe our parents' time and all, it was not compulsory. They used to go to doctor at third month, fifth month directly. But nowadays we can't afford to do that. So go to doctor as soon as you're pregnant, start the medications, get a scan done whenever doctor suggests, maybe at 6 weeks, 7 weeks, wherein we can confirm the pregnancy, we can confirm the heartbeat, and then continue as on. And say another important point is for the pregnant women who already have some medical issues, like they might be diabetic from before, or they might be having some thyroid issues, low thyroid or high thyroid, or they may be having high BP. Whatever these should be more careful. In fact, they should consult their physician before pregnancy, because there are certain medications which are not allowed in pregnancy. So they need to switch the medication, switch the tablet, and see if that new tablet is effective. Adjust the dose of that tablet for whatever it is, maybe thyroid, whatever diseases I've covered so far. So that is very important. Okay. And third thing, again, I'm focusing, please, if at all you're a heavy smoker or drinking alcohol since long, you would need time to stop that and get used to it. So give that space of time and go for preconceptional counseling, taper it, and in pregnancy, absolutely no for any kind of smoking or recreational drugs. And what else? So I think that should be the major point.
So, in addition to that, I have a question. What are the dangerous signs in which you actually have to go and see a doctor? Because we have come up with a few of the women asking us कि brown discharge होता है first
Yeah.
trimester, and they get
Yeah.
really worried about it.
Yeah.
So, what are the dangerous signs? When should they actually worry, and what signs are actually normal?
Yeah. So considering the discharge, normal whitish discharge is like non-itchy, a kind of thicky discharge is absolutely okay in pregnancy, especially in the first trimester. But if it changes color, if it's a bleeding, and along with that, if you have period like cramp, and even brown discharge, I say should not be neglected. If you have a brown discharge, go to doctor, get it checked. Once you're sure baby is doing well inside, the heartbeat is good, there is no blood collection inside, then you can be assured and you can wait for that brown discharge to disappear. But first time brown discharge, do consult doctor. If there is a bleeding, do consult doctor. Mild like lower abdominal dull aching pain is okay, but a period like cramps needs attention. Go to doctor and take proper injections and medications. Constipation is another quite common thing. It does happen in first trimester, maybe with progesterone tablet or as such, maybe due to pregnancy. So you can try doing home remedies like more fibrous diet, whole fruits, and they say even warm milk with ghee is supposed to be acting as a natural stool softener. That can be tried. So, and first trimester pregnancy is not easy to take. Like many girls suffer with lot many symptoms. It's all new for them, but have patience and be positive. ये time भी निकल जाएगा, and second trimester will be quite smooth and relaxing, and you can enjoy that part.
Show that.
Yeah.
It was an amazing, informative session, doctor. So, we can take up with the user questions.
Yeah, yeah, definitely.
Okay, so Swati is asking, she has a history of diabetes and she has been 2 weeks pregnant now.
Hmm.
So what are the, cares to take? What is the dietary changes that she can follow? Because she has a history of high diabetes from
Okay.
like minimum 2 years.
Okay, okay. So Swati, it depends. I don't know now what are you on for diabetes, whether it is only tablets or insulin. So as soon as you know, now that you're 2 weeks, it means maybe 4 to 5 weeks pregnant, get your blood sugar, fasting and PP and HbA1c level. That will give us a rough idea that how was your sugar control last 3 months. And be in constant touch with your diabetologist and your dietitian along with the gynecologist. Over the time, as the pregnancy advances, the requirement of diabetic medicines would increase. You might have to shift to insulin if you're not on tablets. That is the thing, you should be mentally prepared. And having a repeated good scan is also very important. A pre-diabetic mother or a over-diabetic mother, when they get pregnant, slightly the risk of having abnormal babies is little higher, and it can be reduced if you have a good sugars or if you have a good controlled sugar. So you would need a good scan at fifth month. You would need a good scan of baby's heart. We say it as fetal echo when you're just about to complete your fifth month. So this needs to be done. And regarding dietary changes, now that you've been diabetic for 2 years, you would very well know which suits for diabetes or which doesn't suit. So on a rough scale, increase your salads, increase vegetables, reduce again maida products, artificial sweeteners, sugars, and a little bit more focus on exercise, walking and workouts.
Okay. My another user, Kiran is asking. She's 2 months pregnant and she had a history of PCOS.
Yeah.
What is the special care that she has to take during her pregnancy?
Yeah. So PCOD, with a history of PCOD, she might require a little bit of progesterone support, some additional tablets along with folic acid. Again, PCOD patients are more prone to get pregnancy-induced diabetes. So she need to restrict her taste, reduce her sugars and sweet cravings, and a good workout definitely. And repeated sugar screening, maybe now her doctor would have already suggested her. And again, at the sixth or seventh month, she needs to check her sugars. Other than that, I don't think if she's already completed her 2 months, she can relax now.
Okay. The next question is there is excessive nausea, morning sickness that the user is facing. Is there any home remedy that she can follow other than medications?
Yeah. So, see, a ginger is supposed to be a little bit very helpful during hyperemesis. That can be like you can just boil water and grate ginger and put and cover the lid and keep the gas closed. So the juice from the ginger will get into the water, and that water you can sip. Warm water you can sip. That act as a home remedy. And eat food in small quantities. Don't overload yourself. So that will also reduce your heartburn and acidity, and try to have a bland, non-spicy, non-oily food. And I would say if something specific is triggering your nausea, like some people don't like non-veg smell, or some people don't like the rice smell, whatever, whichever doesn't suit you, don't force yourself. You will have some alternative for those nutrients. So switch over to those alternatives and be positive. This time will go. Carry on with your medications. Keep yourself hydrated well. Once you cross your first trimester, the nausea will reduce.
Okay. So Twisha is asking, she has a twin pregnancy and she is
Okay.
suffering from a backache from last 2 months, like
Okay.
mild backache, not a very severe one. Is there any home remedy that she can try or some medications that you can recommend?
So for backache, first and foremost is a good posture. If at all she is sitting for a long time and working on computer, she has to take a good posture, a good back support, a shoulder support, and a support at the lower back. Her laptop should be at her eye level, and her working place should be comfortable. And if she has crossed her third month, she would be given some calcium supplements. Morning sunlights are very beneficial. That will give her more of vitamin D3, which helps calcium to get absorbed. And drink lot of water. Stretching in between long sitting hours, little bit of walk every 2 hours and coming back and sitting, so that that wouldn't cause pressure on the lower back. And hot fermentation can be tried. Any Olini gel or any kind of analgesic gel can be applied without massage. And yeah, if lot of pain, she can take a crocin tablet as well if she's not allergic to.
Okay. So coming up to the last question. So Seema has a history of miscarriage and she has a history of high blood pressure. She's recently got pregnant. She's 1 month pregnant as of now. So is there any special advice that you can give her?
Okay. First of all, she has to consult a doctor as soon as possible. Recheck her blood pressure, how high or how low it is. Reassess the tablets which she's taking for high blood pressure. I think she would need a blood thinner. We call it as ecosprin. Under her gynec's guidance, she needs to take that tablet at least till she completes 8 month. And certain additional tests to look for kidney and liver health, whether that high blood pressure has affected her any inner organs. Other than that, if they can figure out what was the reason for her previous miscarriage, that should be nullified at this pregnancy.
Great, we have covered all the questions. It was an amazing informative session, डॉक्टर. I'm
Thank
sure हमारे काफी सारे यूजर्स आपकी एडवाइस फॉलो करेंगे और ध्यान रखेंगे फर्स्ट ट्राइमेस्टर में whatever advice that you have given and have a happy pregnancy. So doctor, do you want to add anything more for our users?
Yeah, just I remember one or two points. One is regarding like present era regarding COVID vaccine. There is still a lot of fear कि अभी pregnancy के लिए plan कर रहे हैं और we are already pregnant. Vaccine लेना है या नहीं लेना है. I would say please complete your scheduled COVID vaccine dosages. It is quite safe. So many of our patients have taken, and so far things are well. You can just inform your gynac before you take the vaccine. If at all there are any pending doses or you're due for COVID vaccine, go for it. That is the first thing. Second thing is, see, in spite of all said and done, take all the knowledge, all the precautions, all the medication, still some pregnant, let's say around 10 to 20% of the pregnancies land up in miscarriage. That is, out of 10 pregnant women, 2 will end up in miscarriage by the end of the first trimester. So don't take it too much on your heart or mind. It does happen. Then you look for the cause, discuss with your doctor, and go ahead for it. Don't get disappointed with that. That is one tip I would like to give. And generally, the cause for that miscarriage is like an abnormal baby or any chromosomal issues. So that is always good to get it knowing in the first trimester, instead of having an abnormal baby at the end, at the fifth scan, fifth month scan, or when we get to know it, the baby is abnormal post delivery. So do not panic. If at all anybody lands up in miscarriage, don't worry, take it positively and go ahead and
Thank you, doctor. So
welcome.
all my users, Dr. Pritisha is there on video consultation on our Baby Chakra app. You can use the link which is given below. You can reach out to her whenever you want. I'm sure she'll be very happy to solve your doubts.
Absolutely, absolutely.
You can also reach out to me for minor small doubts that you want on Baby Chakra. If it's a doctor related, please go to the doctor. I would advise that. It was a great session, Dr. Shetty. Thank you so much.
Thank you, Seema. Thank you so much. All the best to all the pregnant ladies out here.
Take care. Happy pregnancy.